Okay, let's get started. So, good afternoon or good morning, everyone, and welcome. My name is Olivia. I am the Senior Manager of Brand Communications at Kontakt.io. And today in this webinar, we're going to address the critical topic of nursing, everything you should know about nursing, the complex work environment for nurses, the cost of inefficiencies and errors, and we'll lastly address the solutions that we could deploy to reduce complexity and the chaos in the nursing environment. So joining us today is Dr. Rhonda Collins, Chief Nursing Officer at Kontakt.io. And Dr. Collins is a fellow of the American Academy of Nursing with over 35 years of experience in nursing and leadership roles. And she is a firm believer in improving operational excellence in healthcare. She advocates for simple, high-impact solutions that can make the day better for nurses. And if you have any questions, please enter them into the Q&A box. We'll address them all together at the end of the discussion. And with that, I'll hand it over to you, Dr. Collins.
Thank you, Olivia. I really appreciate that. And thank you to all of you who are taking time out of your busy day to join us for this discussion. I'll try to move along quickly and answer any questions you have at the end. So let's talk about defining nursing work. First of all, I have to give a shout out. The Gallup poll rated nursing as the #1 most trusted profession for the 22nd year in a row. That is quite an accomplishment for my profession. And so I say congratulations to all the nurses out there working so hard every day to ensure that we maintain standards of practice, standards of patient care in a very complex environment. So key elements of nursing work are misunderstood by the general public. I mean, there is the notion that caring is the sole purpose of a nurse's existence, and that's what they do. But ultimately, that can reduce their education and competence. And especially when caring is defined with essential tasks, such as making sure food is delivered on time or that the patients have what they need at the time that they request it. It can get confused in these complex and financially constrained healthcare environments that nursing duties are caring for the patient is overly simplistic. It devalues the education, the training, and responsibility of the nurse. It diminishes the recognition of the vital role of the nurse in providing safe, high-quality care in today's healthcare system. And really, what does devalue that? Is it the impression of the general public? Is it the financial constraints that reduce the time at the bedside for the nurse to essentially function in that caring role because they're doing non-licensed, non-essential tasks for the nurse? So those are some of the things that we want to talk about today in understanding what is the vital role of the nurse, how is the nurse's time spent, and then are there some solutions that have high impact or very low cost that can be implemented or discussed in this technology-driven world to reduce that confusion and that misunderstanding of how nurses function. All of you have seen this slide and these statistics in various forms and formats with a number adjusted here or there. But in general, nurses are responsible for 5 to 7 patients, and that creeps on occasion. They have 3.5 interruptions per hour. You can read through all of this, walking up to 3 miles a day. So most of the activity is spent in communication, which really breaks down to coordinating care, working between departments, working between workers on the unit, finding people, just the constant churn, pardon me, of trying to coordinate the care of the patient through the system for treatments, for activities, etc. And then, which brings us to the question that's being asked every day in nursing is, why are so many nurses leaving the profession? If any of you are active on LinkedIn, you see the constant discussion about nurses have to be involved in their work environment. Nurses need to be involved in decision-making about how they work. nurses have to step up and have opinions and be a force in the healthcare world, because again, we have so many restraints on us that quite frankly are not sustainable. The number of nurses in workforce dropped by nearly 100,000 in 2021, and these are listed as the primary reasons by the National Council of State Boards of Nursing. Burnout, number one, but how do you define burnout? I mean, there's a bunch of different ways to define that. A lot of different causes that lead to that, the pre and post pandemic impacts and the nursing shortage. And at the same time, nurses are advocating for safer work environments and better compensation. And those are just the discussions that we see going on: high workloads, unprecedented burnout levels, and a declining number of nursing support staff have contributed to the high number of nurses leaving the profession. Now, support staff is incredibly important. They are leaving the profession too, because of the complexity and intensity of the work environment. I think that when I opened, I talked about how important it is to have nurses licensed, educated, trained, doing what they know to do to care for the patient. But equally important are the support staff who free the nurse to be able to make those training and judgment decisions in caring for the patient. And when you see an exodus of both, then you have a patient care environment that is essentially unsafe. And one thing I want to remind everyone: no one gets out of this life without needing a nurse. You will all need a nurse before you leave this world. So we have to make it the safest, the best, the most productive, and the most educated workforce that we can, and allow them to work in the way that they know they need to work, give them the supplies that they need and the environment they need to do well. So here is the cost of a complex nurse work environment. Nurse attrition in the United States costs between $5 and $9 million a year. Nurses leaving, hiring nurses, retraining, bonuses, that sort of thing that keeps it churning. The increased cognitive load of interruptions, all of the literature tells us that when a nurse is interrupted in a task, it takes 18 to 22 minutes to get back to where they were in their thinking process and be able to manage what they do. I've published frequently on the topic of cognitive load, the impact of cognitive burden in the practice environment, and the detriment that it brings to caring for patients. There have been some very high profile medication errors made over the last couple of years. When the nurse was interviewed about what caused that medication error to happen, she said it was a chaotic day with many distractions. I spent the entire shift distracted. And she said, I recognize now that I had normalized the deviance of that environment to the point that I just accepted it. So medication errors alone due to distractions have morbidity and mortality costs of $77 billion a year in the US. And then caring for patients with medication-associated errors costs another $40 billion in the United States. So you can see just the cost of how healthcare is managed now is overwhelming. It's why healthcare remains one of the more expensive services that we need in the United States. Nurse harm: 1 in 4 nurses will experience workplace violence. Patient harm: 1 in 4 patients admitted to a hospital will experience harm of some kind. So what are we going to do? At Kontakt, we focus on the environment. There are many, many issues that contribute to this complexity of healthcare, of patient safety, of staff safety, of how we deliver care, how we practice, what nurse-patient ratios are, all of those. I'm not discounting any of them, and I give all of them importance. But for my discussion today, I want to talk about how we improve the environment. And I don't know about you, but when I'm working in an office that's chaotic and cluttered and it's hard to find things and I don't know where anything is, it makes it really hard to do my job. I think that when we have nurses and staff, everyone in the hospital environment delivering care working in a chaotic, inefficient, hard to find equipment environment, it grinds away and adds to the burnout and makes it very, very difficult to do their job. So there was a recent, in a nurse journal, there was a recent survey from nurses just released 2 weeks ago, asking about the environment or asking why you're considering leaving your job. The number one reason on the list was leadership. Well, that's an entirely different presentation and discussion. Leadership is essential to creating teams of people, to creating growth, to allowing for opportunities. And I'm sure there's many of you listening to me today who your focus is on creating the next leaders in the nursing world. And I commend you for that. And so I want to encourage you to continue that work. Leadership is essential. The other is staffing and support that the nurses cited. They said, you know, staffing, having support staff, being able to have an appropriate patient care level, all of those are essential. And there are hundreds of thousands of people addressing this and working on this and studying the science of how we do this better. The third thing that the nurses suggested was the environment, that the environment was too difficult to work in, that they felt unsafe, what they needed was not accessible, and that easily available supplies and devices were hard to find. And it was hard to find information. They spent most of the day looking for information because they just couldn't get what they needed when they needed it. So, and another top of mind issue for everyone in healthcare is the workplace violence epidemic, quite frankly. You can see from all over, hospitals from Massachusetts to Texas to California, the American Hospital Association are all focusing on this problem and how do we solve it? And I would say that everyone has a policy for workplace violence. Everyone has a protocol. Everyone has an idea of how they want to do it. And everyone has maybe a communication device to enable that. But one of the most important things you can do is give the nurse immediate and instant access. Seconds can make a difference. How long does it take to swing an arm or a fist? A second. So if there's any delay in the nurse being able to reach out, that's an issue, and we're going to talk about that. So there's two costly problems that we'll just address. There's many, many problems, but let's start with staff activity, workplace violence. The fact that nurses spend 4 miles a day and 40 minutes a shift looking for whatever they need to do their job is an easily solved problem. And we're still talking about it. I always look at these problems and I think I was at the bedside 25 years ago and I had these exact same problems. And here we are still talking about it. And what I really want to do is motivate those of you who are listening to just be determined, I'm going to solve this problem. This is, of all the problems that are suggested, leadership, staffing, and just making the environment inviting to work in, that one is the one we can focus on. We can look for low cost, easily implemented, effective on day one solutions that can enable and allow nurses to do what they do best in caring for their patients. And we look at every fourth nurse getting assaulted. A third of all the nurses are wanting to quit. Let's solve that problem. We can do that. And we can do it with a single solution. We look at medical equipment utilization. It can be very low because devices are hard to find. I'm a nurse. I used to hoard equipment and devices because I was afraid I wouldn't have it when I needed it. And so we have all of these issues that keep us churning and spending money and not able to effectively work in our environment. Again, one single solution that can address all of these is the financially effective thing to do. So at Kontakt, we have a suite of applications that are ready-made. We can optimize care operations, just managing beds, wheelchairs, equipment, supplies, all of those things. And the staff journey analytics of hand hygiene, medical device on demand, immediate responses for staff safety, and immediate being able to track patients for patient elopement. We have a lot of solutions to see how the patient is doing in the patient room, but if the patient leaves the room, where are they? How do we find them? Where have they gone? These are frequent issues, and if you've seen in the news recently, patients had disappeared, staff was unable to find them, and then there was a very negative outcome on the end of that. So we're able to follow through, again, with a single solution on a single platform and a single investment. A roadmap of AI products will help you grade the patient journey from end to end. You need to find out what are the bottlenecks, what are the efficiencies, and sometimes they don't know. And I'll tell you a little story. I had surgery recently and I was given a surgery packet for numbers to call. I needed to do some rescheduling and I called quite literally every number in the packet, every single number in the packet, and not a single person answered the phone. From the hospital to the clinic, to the doctor's office, to everything, not a single person answered the phone. On day 7, when I felt like it was getting critical, I sent an email to the administration of the hospital and I was able to list, I called this number on this day at this time, I called this number on this day at this time. And what they said to me was, in their dismay, that it had been such a problem was, we knew we had a problem, but we didn't know the numbers or the extensions, and we didn't know how to identify it. So although this has been a negative start for you, and please accept our apologies, the reality is you helped us identify the problem. And we had never had that information before. So what I'm suggesting is you may have all kinds of bottlenecks, issues, patient complaints about accessibility, staffing complaints about where supplies are kept, but you have no idea where the bottleneck is. You have no idea where the problem resides. And we can identify that for you and provide that information and information about the inefficiencies in real time. We can focus on the clinical path, how patients move through the hospital, focusing on bed utilization, and of course, schedule for transport and radiology and OR and all of those things. And addressing friction and wait times is hugely important. I've worked in the healthcare environment for many, many years, but I've also been a patient. And it is a very different experience when you're sitting wondering what's going to happen next. And so I think that being able to provide that information, address the delays and wait times in real time really allows you to uncover the hidden waste, maximize your capacity, and improve your workflows ahead of time. So while our platform will allow you to address all of these in the application roadmap, I would suggest that you start with entry use cases and what is your most pressing problem. I'm going to suggest that it's keeping your staff safe. It is really important that in this environment, I've had people ask me in the past, why do you think patients are so angry or families are so angry? And my answer is, we're living in an angry time, and that spills over not just from social media or what's going on in the world, but it spills over into when people are the most stressed they will ever be in their lives, which is an illness or a surgery or being in the hospital environment. But I think the first thing we have to do is make the staff safe. We have to make it where the response is immediate, and you shouldn't have single endpoint solutions, one solution to keep the staff safe, one solution to find equipment, one solution for hand hygiene, one solution for the patient journey, and that sort of thing. A single low cost, sustainable across all operational platforms and patient safety will really create an environment where individuals can function as they are trained to function, where nurses can then lead with their nursing capabilities and the environment is one that is easy and desired to work in. So, Olivia, I'll turn it back to you for some questions.
Thank you. A lot of good insights. Actually, I'm looking at the questions, and there's some interesting questions out there. First question is, over your course of nursing career, what kind of major changes in the nursing environment have you observed?
I would say the first thing is technology, what technology has brought to the environment. I've actually done quite a bit of research in the past about nurse adoption of technology at the bedside. And I think that when you have multi-generational workers, that adoption has varying levels of expertise. But I do believe that technology is the answer for solving operational issues, allowing us to be creative in how we staff and how patients are cared for. There's so many exciting solutions out there. I know that the electronic health record actually was very congestive and confusing for a long time. I think that we're finally getting on the other side of that and understanding exactly how we can make it work for us and not us work for it. And so I think those are the major changes that I've seen. I do believe that staffing ratios and numbers have ebbed and flowed pretty much along the same lines as long as I've been in nursing. But the most dramatic change, 100%, is the ability for technology to improve the work environment.
Awesome, thank you. I think we have time for one more question before we end the webinar. So, how can nurses and nursing leaders actually make a compelling business case in their health systems to use technology and improve the nursing environment?
Yeah, that's a great question. I think that when you identify as a nurse leader, if you are working and you identify a problem that you think there's a technology out there to help you solve that problem, work with the vendor and allow them to help you create the business case. Because we're really there, we have clinical experts who understand exactly the problem you're trying to solve. We understand the workflow, we understand your barriers and your requirements, but we also have business people and business partners who can help you create that compelling case with financial outcomes to present to your board. I've worked with many nurse leaders to help them prepare presentations and documents and executive summaries so they could progress with that. And you can't be afraid to do it. And I speak at ANIA and a lot of nursing conventions and nursing informatics organizations. And I get this question a lot, surprisingly, is how can we be effective? And I'm going to tell you, sit at the table, take up the space, and be there and be present and let everyone know that you as a nurse are passionate about what's happening in the patient care environment, what's happening for your profession, and that you have identified solutions that you want to talk about. I can't stress that enough. And I would always tell my staff in other jobs, sit at the table, take up the space, voice your opinion, and you will become more comfortable with that. Trust me on this. And you will be able to make a difference in your organization.
Great, thank you. I think our time is pretty much up. So thank you again, Rhonda, for this wonderful presentation. And thank you all for joining us today. We'll share the webinar recording shortly after this webinar. So, stay tuned. But if you have any specific question, please feel free to reach out. I dropped an email address here. So, you can feel free to contact us at any time. So with that being said, thank you everyone for jumping on the webinar, and we'll hopefully see you again in the next webinar.
Thank you.